I think that's meeting the user where they are, especially when you're dealing with trauma and distress. It's both like
investing your own learning. Spend that money. Sit down and study up because you're not going to regret it. It's only going to give you
really exciting to see these kinds of things come to life. The vision finally gets really concrete, but it's actually something that's working.
With MyndStrong, we are a healthcare technology company. Having all of that watertight is of utmost importance. And that's where I think my clinician policy background really lends me well.
Welcome to another episode of AI Product Leader. Every week we shine a light on what it really takes to join the AI world. Real conversations with real AI builders, founders, product leaders, AI experts, technologists, and everything in between to understand where the world of AI is right now and what that path looks like, whether you're building an AI product or a career in AI. Have a question or topic? Be sure to send us an email at support@aicareerboost.com and join in on the conversation. I'm Polly Allen. I'm the founder of AI Career Boost, where I spend my time helping product managers and leaders navigate the world of AI and thrive in AI leadership roles. I've spent my career on both the software development and the product management sides of the software development equation, and I'm an ex-Alexa AI principal product manager, where I successfully launched the very first generative AI answers on Alexa back in 2020. I'm a Top 100 Women of the Future award winner, and I'm extremely excited to chat with our guest today, Dr. Yisha Stiskala-Yu. She's a clinical psychologist, scientist, and AI product leader, revolutionizing the digital health and medtech innovation space. With over a decade of experience at the intersection of psychology and technology, she advises VCs, startups, and investment firms on AI-driven healthcare solutions, clinical governance, and go-to-market strategies. A former clinical lead for elite athletes on the Australian Institute of Sport and hospital-based psychologist as well, she's also now focused on advancing digital therapeutics, healthcare AI, and precision medicine. And through her work with What If Ventures, Venture Blick, and Global Innovation Initiatives, Yisha is shaping the next wave of transformative healthcare technologies. Yisha, thanks so much for joining us today. I've been so excited to chat with you.
Oh, thank you so much for having me, Polly.
I'm so
A
excited.
wonderful intro. I won't be able to fit my head through the door.
Well, it's all true. So you should be proud of all of these things. It's amazing. Um, I'd love to kick us off. Just tell us a little bit about your background. So before your journey into AI, you were working
Yeah.
in the clinical psychology space. I'd
Yeah.
love to hear a little more about your story in that space before venturing into this wild world of VCs, startups, tech
Yes.
even.
Yes. Wonderful. So I'm 37 now,
Hmm.
and I started my career working in homeless shelters in Sydney, Australia for
Wow.
4 years while I was journeying through my undergraduate psychology studies.
Mm.
Um, and that experience, that ground level experience, working in the front line with very underprivileged people, uh, exposed me to the best and the worst of humanity very early on, and I
Very early, yeah.
really early on, and I think between 20 and 24 was very formative. Uh, Life experience, and it forever shaped what I wanted to do for the rest of my life. I just could not see myself working in a corporate role where I was making money for for companies or people,
Yeah.
and I really leaned into a life anchored in meaning and purpose, and alleviating or doing my part to
Yeah.
alleviate human emotional suffering. And so it really made sense for me to continue my studies, following my honours degree in psychology, undergoing a master's and doctorate in clinical psychology, uh, and spent the rest of the next 13 years on the front line in a wide range of clinical settings. So,
Wow.
from being a research clinician to working in a psychiatric hospital for 9 years in the very acute phases of people's
Yeah.
illness. But also towards the end, having proved myself to my traditional medical peers, uh,
Hmm.
had opportunities, random opportunities that came my way, such as being a performance coach to podium level athletes, um, and moving into more venture and startup space, and the journey to that also was it was seeded by a very peculiar work opportunity early on in my mid-20s,
Oh, yeah?
where my professor uh, was given a $17.8 million check by the government to build a national digital mental health clinic, uh,
Oh,
to provide free digital psychological treatment for the Australian public. So
oh,
very early on in my career, before telehealth was mainstream,
yeah,
I experienced this very unique, not venture backed,
yeah.
government backed startup experience where I was
Amazing.
able to really see what technology was able to enable in terms of reducing friction to quality care.
When was this? Like what around what era? Like
2012,
nice. And
2012 and
before
2014.
telehealth was really and what was the vision at that stage of what you could even deliver digitally for
Um, it was doing what we can to translate quality CBT based treatment,
Mhm.
digitizing that, plugging it into a platform, and making it much more accessible to people living in rural areas of Australia. Australia,
Mm,
as you know, is quite geographically spread out.
yes.
So the national clinic was our part to just break down access barriers. So it was a mission driven team, and it just forever changed my uh, how I thought about therapy, how I thought
Huh.
about the use of the thoughtful use of technology to
Mm,
deliver care.
yeah,
So that was a very cornerstone experience,
of course.
and so it felt very full circle after having spent time in the venture space, understanding the crazy world that is startup, understanding how venture capital works, um, and also on the back of COVID, just seeing so many digital health startups coming out of the woodwork.
Right. Yeah.
Um, but at the same time, leveraging technology as a connector piece,
Mhm.
or solving a logistics of a fast shipping solution, as opposed to using the technology to actually deliver care.
Mhm.
Uh, it 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 just really um, it just felt very full circle for me to step into my own strong sense of conviction of being able to build software as care,
Yeah.
um, because that's what we did in
Totally.
2012, and it
Yeah.
that leap didn't happen, and I think part of it is because the vast majority of digital health startups are not centrally founded by frontline healthcare professionals. Um,
Gotcha. Totally. And did you feel like at the time too you saw it working? Like where was it working and where do you see there's room for improvement? We've got to fix this going
in terms of the
the digital care as opposed to like, the digital care actually affecting people who you're trying to treat.
Yeah, what we saw in 2012 to 2014, because there was an innovation hub that launched out of a research clinic within the university. So we were very
Yeah.
evidence based.
Mm,
We saw incredible results. We
amazing.
saw people be able to experience significant reduction in their symptoms from moderate to mild,
Yeah.
or even from severe to mild.
Mm,
So we knew that it worked,
yeah.
and there was a lot of room for more quality digital therapeutics to be widely disseminated into the world.
Mm, yeah.
What I saw as I was approaching my mid 30s was a significant escalation in mental health crisis. You know, as a frontline medical
Mm,
worker, we were at
especially.
war with
Mm,
uh, widespread psychological distress.
mm.
Uh, we were losing one young person every 40 seconds to suicide. Right.
Wow.
Mm.
Yeah.
We have so many people committing suicide every year. It really just made sense to me for
Mhm.
us to leverage technology to make care, early intervention and preventative care much more accessible,
Mhm.
serve the missing middle. Apps like Headspace and Calm, they're
Yeah.
wonderful, but I felt that they lacked the depth and the richness to meet clinical distress that the
Gotcha.
population was experiencing.
Yeah, they're mostly intended for like they're like meditation apps or they're like general
I think
health
symptom
preventative.
improve the moment, relaxation, but it wasn't targeting the real issues that people brought to therapy. People wanted to heal from heartbreak, childhood trauma, really difficult emotional neglectful experiences from their parents, and I was able to see the solution in my mind so clear. Building a startup felt like falling pregnant to an idea. It's an embryonic idea that just grows inside of you and it goes to try to um, and I think when I finally made the decision to become a startup founder, and it was also on the back of doing soul searching because I was presented with opportunities to go down the venture path and becoming a full-time investor.
Yeah.
And I just realized I wasn't an investor. I'm a founder.
Okay. Yeah. You're a builder.
I'm a builder, and
Yeah.
interesting synchronistic life events happen. My hubby was offered a position in Singapore. We uprooted to Singapore, and it just felt like I stepped into a stream of innovation,
Mhm.
and um, that was really supportive of my path forward as a founder. And
Yeah.
and so the baby has been growing inside of me, and it will be birthed into the world.
That's right. Well, yeah, and I'd love to hear more. I know you've been working on an AI first startup. I'd love to hear how that's going and the vision you have for it for the world.
Yeah, yeah. So our mission is to do our part to alleviate emotional suffering
Hmm.
by serving the missing middle. So people who are not well enough to to feel balanced and supported by calm and headspace, but also people who haven't been sick enough for long enough to have the courage or have the
Mm.
financials to land themselves into care. There are
Yeah.
so many barriers to care. And so we want to create this instant access to a complete library of
Hmm.
learning journeys that is preventative and early intervention,
Nice.
that is both symptom reduction based, that helps people to manage symptoms of anxiety, depression, OCD, and trauma,
Hmm.
but also beyond the clinical lens of pushing down symptoms, a library of learning journeys that meet the needs, meet the complexity of being human. Being human is
It's hard these
emotional,
days.
complex, right? So a learning journey for every story,
Mhm.
and and if the journeys can empower our vulnerable uh, users to have more self understanding
Yeah.
of the path forward,
Hmm.
and it can optimize their care pathway and give them the courage to seek more additional face-to-face support, that's success to us.
Yeah.
If it can also give them mental models, frameworks, real-time daily practices that help them feel more soothed in their nervous system and feel more grounded, that's a success
Mm.
to us. So I
Right.
think the beauty about building your own startup is you get to create your own utopia. There's no rules. You reimagine the system. And I think being a therapist and having worked in venture and just seeing the gross underrepresentation of women, both
Hmm.
at the investment level
Yeah.
with LPs and at the founder level,
Right.
um, it really uh, it really holds me to accountable to building a company that can show the world what women can build, because we're
Yeah.
thoughtful, we're intentional. We don't just throw things at a wall and hope for product market fit and pivot, right? We build from um, a deeper place of knowing,
Mm.
ground.
Grounded,
Yeah.
grounded knowledge. Amazing. Oh my gosh.
And having a teacher like you, Polly, you democratizing your wisdom has given me so much grounding to my build as a founder. And so
Oh,
I'm
thank
incredibly grateful.
Oh, well, I'm really grateful that to be able to be part of your journey. I was so excited. I remember when we first began speaking, you knew you wanted to use AI.
Yes,
Felt a little intimidated as a founder as to like, will I have the skills to know how to apply this and apply this wisely? How
yes.
did you know you knew AI needed to be a part of this product? Like, when did that moment happen?
Um, I've always loved technology,
Mhm.
and it's the world has experienced a technological leap, right? And I
Mhm.
think there was a moment a couple of years ago where I realized everyone who are willing to put their student hat on
Mhm.
and have the humility to have their brain upgraded will be uh, will be superhuman. So, and I think with AI is broad. There's depth, there's
Yeah.
range. So one of the first things I did was I signed up to a course through MIT X Pro, and I studied the math from
You
professors.
went deep.
Very
Yeah.
dry. It helped me make sense of it because I didn't feel like it was the right thing for me to just watch YouTubers and TikTokers
Mhm.
to feel like I've leveled up. I really wanted to. I want a grounding
Yeah.
in my learning, and
Gotcha.
it's a well practiced role because I've studied a lot. I've gotten a few degrees under my belt.
Us us type A's have tendencies. That's like, I'm gonna do the full course, the whole way
Yeah,
through.
but I loved it. I loved it. I love to grow my mind, and so after doing that course from MIT X Pro, I knew that uh, thoughtful, intelligent use of specific aspects of AI can
Mhm.
absolutely transform an industry, in particular healthcare, because
Yeah.
healthcare is so deeply institutionalized. It took a lot of effort for me to even convince my colleagues to use an e-fax, right?
Wow,
Um,
okay.
Technology is in dark ages in healthcare,
Yeah,
and but I was really able to see thoughtful leveraging of specific components of AI technologies
yeah,
to um, create products that can heal the
yeah.
population at large
Mhm, and scale to do that.
and at scale in
Mhm.
a not in a broad stroke or rapper kind of way, a really thoughtful, emotionally resonant, empathetic, human centered way.
Mm, yeah,
Um, and so I continued on my studying journey. I've got a couple of learning tracks, and working through your AI product leader course was one of the learning tracks along some of the others. And I'm
yeah.
at a point of finalizing my blueprint where I'm feeling really excited about putting it all together.
Oh, fantastic. Yeah, I don't know how much you can share because I know your startup is still in stealth. Can you
Yeah.
tell us a little bit about how you plan to leverage AI? What kind of aspects you plan to leverage in that space?
Yes. So, um, well, there is an anchor back to minimalist in design. So just because AI is available, we're not going to add so many different components of AI. So the core offering is our complete library of early intervention preventative learning journeys, and
Mhm.
that is proprietary and built from the ground up. That's going to do 80% of the heavy lifting in terms of emotional healing.
Gotcha.
um, and the content aligns with clinical protocols drawn from research.
Gotcha.
That is also very human centered in design, very warm, very empathetic. The AI allows for personalization,
Mhm.
engagement, the drawing of questions and answers that can give vulnerable users here and now support.
Mhm.
Um, so that when someone is in a moment of high distress, they're not having to think about which lesson it is that had the relevant information. It's able
Right.
to intelligently pull from our bespoke vector database
Mhm.
specific the specific skill or the
Yeah.
specific grounding affirmation. So,
Mhm.
as an example, if if a vulnerable user is um, hyperventilating, feeling highly distressed,
Yeah.
and is needing soothing and grounding to tolerate the distress of the moment,
Mm-hmm.
we're going to be able to leverage the AI build for
Mm-hmm.
our user to receive the right information at the right time in the right moment.
Nice. Yeah, totally. And I think that's meeting the user where they are, especially when you're dealing with trauma and distress, right?
Yes,
It's both
yes,
like it's there's that personal side, it's the psychology side of being sensitive to and empathetic with that state, but then there's really knowing what information is going to help them.
yes,
They don't
yes,
know what to ask for in that kind of
yes,
space, right?
yes.
Yeah.
So to be a gentle guide, we're not here to be a companion bot. We're not here.
Mhm.
So the
Yeah.
AI elements to our product roadmap isn't to be that humanoid friend, which I know
Mhm.
some of the other startups are going down
Yeah. A lot of
down that.
companionship kind of thing. AI girlfriend.
Right, right. With MyndStrong, we are a healthcare technology company. And so precision, accuracy, clinical governance, having all of that watertight is of utmost importance. And that's where I think my clinician policy background really lends me well, because I want to build and scale with integrity and safety at front of mind. So our AI product roadmap is very much about uh, empathetic, intelligent question and answer knowledge assistant.
Yeah, totally. That makes a lot of sense. And is it, I remember as part of the blueprint, you actually got to build kind of a prototype. Can you
Yes.
describe how that helped you as a founder? Like what did that give you in terms
Right,
of
right,
understanding?
right. The prototype that I demoed to you, Polly.
Yeah,
Oh,
exactly.
right,
Amazing.
right. Yeah. It felt like I was pushing the boundaries of um, my healthcare knowledge and technology in my own room, creating a prototype and seeing if it works.
Yeah,
And what I had created for you, Polly,
yeah.
um, it it gave me confidence in being able
Mhm.
to pitch my ideas to my tech members, right? Because what I built is absolutely not ready for real world
Right. But it's
dissemination.
a prototype.
It's
It's,
a
a
prototype.
proof of concept, right?
Um,
Yeah.
yeah, yeah, and so this is it was just really fun. It was very experimental. It just felt like being in my labs and seeing if it can actually work and whether it
Yeah.
makes sense.
Yeah.
And again, thank you again for giving me that opportunity.
No, I'm
It
so
did
glad.
challenge me,
Yeah.
but it was a very important part of my founder journey, creating that
Yeah.
prototype.
Oh, fantastic. It was just really exciting to see these kinds of things come to life where like the vision finally gets really concrete, but it's actually something that's working and you have a sense of what's hard and what's easy going forward.
Yes, yes, yes.
Yeah,
There are
absolutely.
aspects to the AI build that emulates what happens in therapy, right?
Mm,
In therapy, when a vulnerable person comes to a session, they often have the wisdom deep down in their gut, right?
hmm.
But it's that conversational dance of query and answer that helps one to feel more sure of themselves. And so that's the added component that we want to layer on top of our learning journey that we think will make MyndStrong um, very, very rich in its offering
Yeah.
and
And the
so
impact.
unique,
It's more than
impactful.
just the content. It's like how that's delivered and how
Yes,
people absorb
yes,
it. Oh, it's
yes. The
fascinating. Yeah.
dance to the
Yeah.
conversation. And
Amazing.
there's a recent quote that I learnt, and it goes along the lines of, if you need to find someone to sell umbrellas in the Sahara Desert, you'll be able to find one. You just need to keep looking. There are so many different aspects to MyndStrong that to do it well requires a specific talent, right, with a specific
Mm,
player card. And and where I see myself as the founder is
yeah.
to have the humility to learn as much as I can across so many different tracks,
Yeah.
but also to to share my manuscript and also give the manuscript to the right people to make the movie. Right.
Right. Yeah. Yeah. Totally. I love it. And painting that vision, I think, is a special talent of yours that I think like that
Oh,
fits so well with your founder journey
thank you,
of
Polly.
making
Thank
it
you.
clear how, how human-centered this needs to be effective, you
Yeah,
know?
yeah. And I think technology, it's absolutely possible for us to create technology products that feel really warm
Hmm.
and soothing and empathetic, but it
Yeah.
requires um, unique unique vision on UX UI to the
Yeah.
conversational flow, right? Or
Yeah.
making it actually humanist. So
Yeah.
the execution part, it will take a lot more manpower, talent to make it come together. But at the moment, it just feels like the universe is rearranging itself to support the birth of MyndStrong. So
Amazing.
very
Amazing.
ready. Yeah.
That's so exciting. Well, fantastic. You'll have to let us know when it does become generally available, when we can help beta
Yeah.
test, etc.
Yes.
The community would be super happy to
We'll be
do that.
one of the first to see it.
Fantastic. And so this is an amazing transformation. You just said you were excited about this space. You dove in and took some courses. For other people who are looking to get into AI, pivot into AI, bring it into their products, have a deeper understanding, what would you recommend that where they start? Where do you, what's a
Um,
one sentence summary of how to get started in AI?
yeah. I think bringing a curious, childlike wonder mindset. So
Hmm.
it's a combination of curiosity and humility. It's the time
Mm,
to drop your ego and not expect yourself to know everything because it has been a technological leap. I think that humility and the curiosity and aligning with those two modes of being
I love
will unlock the right path of learning. And
it. Yeah,
it's about following your excitement because you will gravitate towards the right teachers, the right mentors. And when you feel that click of, oh, that
hmm,
course is it sounds fantastic,
hmm,
invest in your own learning,
yeah,
spend that money, and sit down and study up because you're not going to regret it. It's only going to give you a deeper sense of grounding and allow you to birth into the world something that is unique
amazing.
to you. So,
Yeah.
yeah, I think it's more soft skills, curiosity and humility, and step into the river
I love
of learning.
it. I love that advice. That's
But
fantastic.
do Kelly's course. It's amazing.
Oh, thank you. I'm just so glad to see what's coming out of it for you, especially. Well,
There's so many
fantastic.
notes that I'll have to go back to as well and integrate with your course.
Oh, awesome. Yeah. And we will have you in with the alumni community who's like, so lots of people are going back through the modules, as we speak, kind of
Yes,
thing, too.
yes,
Yeah.
yes.
Fantastic. So we have time for one last section, and that is plugs. Do you have anything you want to plug? What should people contact you for, Yisha? What are you looking for right now or want to promote?
Um, Feel free to reach out to me on LinkedIn and connect.
Okay,
Um, I am always open to connecting with mission-driven, passionate leaders in
amazing.
product and technology spaces um, who align to the deeper calling of doing their part to alleviate emotional suffering. Um,
Mm,
have, I am building a really wonderful team, but uh, what the blueprint of what we have engineered is it's bold, it's ambitious, and it requires talent. So
yeah,
I think yeah, just that openness to connecting with passionate, talented people
amazing.
is probably what I am currently open-hearted for. Uh,
Fantastic.
and yeah,
Okay, perfect. We'll include your LinkedIn in the show notes. Make sure
oh,
we'll get that and people can look forward to connecting with you. That's awesome.
thank
From
you.
my side, I'd love to promote that we have a new free masterclass coming up. So the Path to AI Product Leadership. It's where a lot of people like Yisha have first been introduced to me and taken a look at what the courses we offer. So it's a free masterclass. We offer it every month, so please join us. And as always, I love to plug the show. So don't forget to like and subscribe. If you enjoy hearing conversations from the real people who are building with AI and their path to how they got there, please do make sure you promote the show, share it with others. And that's all for this week. So it's been another episode of AI Product Leader, a particularly inspirational one. Thanks so much, Yisha, for joining us. And
Oh, thank you, Paula,
we're
for
really
having
glad
me.
you could make it.
Thank you, Paula.
Yeah.
It's been a pleasure.